Hello friends, today we are going to talk about life after hip replacement surgery. So if you're planning for hip replacement surgery, first of all you should know these important points that I am going to talk about in this video. First of all, after your hip replacement surgery, you are supposed to sleep in the position either on your back with a pillow under your knees to fold the knees slightly and to keep your legs away or abducted. Secondly, whenever you are allowed to sleep on the side, you should lie on the unoperated side, that is your good leg, with a pillow between your knees to prevent any crossing over. Also, when you start walking, first of all, initially for a day or two, you should use a walker. If after that you are allowed to bear weight on your leg, then you should switch to a stick. A stick or a cane can be used when you are walking, and it should be held in the opposite hand, not on the side of the operated limb. Normally, within 2 to 3 days, you should be able to walk comfortably with the help of the stick if you are allowed to put weight over your operated leg. And normally, within a week or 2 weeks, you can shift the cane and you can come to independent mobilization also. Also, when we talk about climbing stairs, it is always good to go up with your good leg. That means whenever you are climbing stairs, your unoperated leg should go up first, then your operated leg. And when you are coming down, you should come down with your operated leg first. Think about it again. Going up with good, that means unoperated leg, and in the operated leg or on the operated side, you should use the stick or cane to climb up the stairs. When you are coming down, you should use the stick on the operated leg, and then you should move it down towards your good leg. Also, when you are allowed to sit, initially you should use a chair with firm hand grips and armrest. And your hip should be at a slightly higher level than your knees. You should sit back so that your back touches the support of the chair, and you should rest your arms over the armrest. And keep your operated leg slightly forward to lower yourself so that you are sitting comfortably. When you are sitting in the car, you should sit in the front passenger seat and recline your back slightly, and you should keep your legs little apart. Normally, we say the angle of the back should be around 110 to 120 degrees. When it comes to using the toilet seat, one should avoid Indian toilet seat, or if you have only Indian toilet seat at your home, then you should use a portable raised seat so that you don't have to squat down. However, it is preferable to use a Western commode at all the times, so that the longevity of the implant life is there. Also, for your exercises, you should go strictly as per what your physiotherapist is suggesting. But to start with, you should do gentle ankle pump exercises and quadriceps and gluteal exercises. At around 1 to 2 weeks, heel slides can be done. Straight leg raising, if your surgeon allows, it should be done. And around 2 to 6 weeks, you can slowly move to cycling with a high seat and low resistance. After 6 weeks, most of the patients are allowed to walk freely. They are allowed to do cycling. They are allowed to do swimming. But high impact activities or exertional sports should definitely be avoided. Driving, normally we allow between 4 to 6 weeks once the patient's pain goes away and there is no need for painkiller medicines. Desk job, most of the patients, they start between 2 to 4 weeks. Or if you are into a standing job or light duty, then between 4 to 6 weeks. Heavy manual work, normally we do not advocate, but if required, patient can start between 8 to 12 weeks. Flight travel, normally after 4 weeks we usually allow. But it is important to wear compression stockings during your flight travel so that you don't develop DVT, that is deep vein thrombosis. So if you want your hip to last long, normally with today's technology, we have hips that can last around 15 to 20 years. You should definitely try to keep your weight under control. stay active with low impact exercises only, not high impact exercises. You should do regular follow-ups with your surgeons. Like I said, initially you should walk with a walker, then move to cane, and then independent walking. You should always avoid deep bendings or crossing your legs. Crossing your legs also includes sitting cross-legged or using Indian type of toilet seat or squatting. A good option is to raise your toilet seat so that you don't have to squat low. Like I said in the stairs, you should go up with your good leg and come down with your bad leg. Safest exercises for you are walking, cycling, swimming, no impact sports, and driving you can start between 4 to 6 weeks. All the best for your life. Thank you.